Hi folks, I'm not sure he's going to be calm enough for this video. I'm going to make a little video. I'm a board certified body worker and I thought I would demonstrate ocular compressions. There's been some questions about it. He's just eaten and he might lay down and sleep. We'll see if he'll cooperate. It's a good idea to practice ahead of time so they kind of know the sensation. Ocular compressions are pressing on the actual eye orbit, down and in, just ever so slightly. And what it does is it floods the brain during an episode or prior to an episode with GABA. GABA is a neurotransmitter that sort of is inhibitive, and it works along the same lines as diazepam, which is Valium, phenobarb, and the anti-epileptic drugs. So I'm going to go ahead and demonstrate. He's just looking at the camera at my husband, wondering what's going on. Basically, you can, if I'm facing the dog, I might use my thumbs, but since I'm behind him, I'm going to use my 2 fingers. And you just sort of pet and shut the eyes, stroke a little. This feels nice. And then you just press ever so lightly, like you're taking a pulse, for about 5 to 8 or 10 seconds. And then release. And you want to do a certain number of reps. I would get the dog used to it at first because it's a funny sensation if you try on your own to press on your closed eyelid. So then I'm going to do another repetition. And they say 5 or so repetitions is good. So I'm just pressing a little. I can feel his little eyeballs kind of moving around as if you were sort of doing it to yourself. And then I release. Often when we do this, I have noticed that there's a relaxant component to this technique because he will chill out and go to sleep pretty soon thereafter. He's coming due in a half an hour for his pheno and then a couple hours after that for his Keppra. So I'm just doing another one and he takes to it really well. He's pulled away a couple of times, and then release. You certainly can massage up here in the parietals and on the side, but that is not part of ocular compressions. It's the actual technique of pressing on the eyeball itself with the closed lid for a certain number of seconds, 5 to 8, and then again some repetitions, say 4 to 5 repetitions, and that's about it. And that's, what do you think?